Your fingernails may be trying to warn you about something deadly, and most people ignore it completely. What looks like a harmless color change, a faint line, a ridge you've had for months could be your arteries sending a signal through the only surface where early vascular damage becomes visible without a single medical test. By the time chest pain arrives, by the time the shortness of breath and arm numbness show up, it is often far too late for the quiet warning your nails were giving you months or years before. Clogged arteries do not start in the chest. They start in the microcirculation, the smallest vessels, the ones furthest from the heart, the ones that show stress first, long before anything appears on a standard cardiac workup. Your fingernails are fed by those vessels. When plaque begins narrowing the arteries, when oxygen delivery to the periphery starts to fail, the nail bed is among the first tissues to reflect it. Nails grow slowly, built from cells that depend entirely on the blood supply beneath them. When that supply is compromised, the evidence accumulates layer by layer in ways a cardiologist knows how to read. Think of your nails as a slow-growing record of your vascular health, a 6-month archive of what your circulation has been doing while you assume everything was fine. This is what researchers call microcirculation failure, the earliest detectable stage of arterial disease visible in the extremities before any imaging would show significant coronary blockage. By the time a stress test catches a problem, microcirculation has often been compromised for years. One of the signs I'm about to show you is so subtle it gets dismissed in routine checkups, even by doctors who should know better. Here is how the damage happens. Atherosclerosis begins with inflammation, not obstruction. Inflammatory cells accumulate in the vessel lining. Lipid deposits form. The arterial wall thickens. The channel narrows. As that narrowing progresses, blood flow to the extremities drops first. The body prioritizes the heart, the brain, the vital organs, the fingers, the toes, the nail beds. The last stop on a delivery route getting progressively slower. A fingernail replaces itself completely in roughly 6 months. That slow growth is exactly why it records circulatory problems so faithfully. A brief disruption leaves no mark. A sustained one does. This is not cosmetic, not a dermatology question, not something to address with a better hand cream. This is your body asking for help through the only visible window into your peripheral circulation. 9 signs, from the most commonly overlooked to the most serious. Sign number 9 is the one I pay closest attention to in patients. By the end, you will know exactly what to look for and exactly what to do if you find it. Look at your nails now, not later, now. Sign number 1, pale or white nails. Healthy nail beds are consistently pink, oxygenated blood flowing through hundreds of tiny capillaries close to the surface. When arterial narrowing reduces the volume and pressure reaching the nail bed, that color fades, sometimes almost white. The capillaries are still there, but receiving less blood under less pressure, carrying less oxygen. Press the tip of your finger firmly for 3 seconds, then release. Healthy circulation returns pink within 2 seconds. This is capillary refill time. In someone with impaired peripheral circulation, the refill hesitates. That hesitation is the vascular system telling you something. Pale nails alone are not a diagnosis. They can reflect anemia, low blood pressure, or cold hands. But in someone over 60 with cardiovascular risk factors, combined with any other sign on this list, they become significantly more meaningful. Sign number 2, slow nail growth. The average fingernail grows approximately 3 millimeters per month. In reduced blood flow to the extremities, nail growth slows. The cells in the matrix aren't receiving adequate oxygen and nutrients to replicate at normal rate. Most people never notice a 20 or 30% slowdown because they trim nails when they're long and don't measure. If you've begun trimming less often, not by choice, but because they simply don't grow as quickly, that has clinical relevance. The supply chain to the nail matrix is underperforming, and that supply chain serves the heart when it functions at full capacity. Small observation, potentially significant signal. Sign number 3, cold fingertips with nail discoloration. Cold hands are often dismissed as a personal quirk. Sometimes that's all it is. But when persistently cold fingertips are accompanied by a change in nail color, a dullness, a grayish or yellowish cast that wasn't there before, the combination points to vascular narrowing, limiting both warmth and oxygen delivery simultaneously. The discoloration isn't dramatic. It looks like slightly less healthy nails than you remember. That subtlety is the danger. The same narrowing producing cold fingers and dull nails is part of the same arterial process that further upstream is affecting the vessels supplying the heart and brain. If you notice this combination and are over 60, this deserves a conversation with your doctor. Not next month, soon. Don't accept slower nail growth or persistent nail dullness as inevitable aging. It may not be. Sign number 4, a bluish or purple tint, cyanosis. This is where we move from subtle signals into territory requiring immediate attention. Cyanosis indicates blood reaching those tissues is carrying significantly less oxygen than it should. In a healthy system, blood at the nail bed is oxygenated, bright red, appearing pink through the translucent nail. When oxygen saturation drops, that blood becomes darker, more purple blue. The color reflects what's in the blood, not just how much is arriving. Pulmonary problems, cardiac problems, or peripheral arterial disease severe enough that blood is shunted away from the extremities, arriving at the nail bed already depleted. In all 3 cases, cyanosis is not a sign to monitor. It is a sign to act on. Persistent blue or purple nail beds unexplained by cold, particularly with any shortness of breath, fatigue on exertion, or chest discomfort, require same week medical evaluation. Not self-monitoring, not wait and see. This is the sign where observation time is short. Sign number 5, vertical ridges, the circulation link kind. Most adults over 60 have some vertical ridging. Most dermatologists attribute it to aging, reduced nail moisture, normal structural changes. That explanation is incomplete. Vertical ridges can reflect reduced nutrient delivery to the nail matrix, deficiencies in the oxygen and micronutrient supply that maintain smooth, consistent nail plate production. When inadequately supplied, the matrix produces nail plate irregularly. Over successive growth cycles, ridging results. Mild ridging in an older adult is not alarming in isolation, but prominent ridging that has become more pronounced over months, combined with other signs on this list, points to progressive deterioration in peripheral delivery. Most people are told this is just aging. That is not always the truth. Sign number 6, brittle, cracking, or splitting nails. The nail plate requires continuous supply of biotin, zinc, iron, and adequate protein to maintain structural integrity. The delivery system for all of these is the blood supply to the nail matrix. When that supply is compromised, the nail loses flexibility. It cracks under normal mechanical stress, the kind a well-nourished nail handles without damage. It splits vertically. The tips peel. This is routinely attributed to dehydration, harsh soaps, or nutritional deficiency, a biotin supplement, a hand cream, a change in detergent. Sometimes those help, because sometimes the cause is exactly what it appears to be. But brittle, splitting nails that don't respond to nutritional supplementation and improved hand care, even someone over 60, may not be a nail problem at all. They may be a delivery problem. The nutrients are available. The vessel carrying them to the matrix is what's changed. When I see this in a patient who has tried the standard remedies without improvement, my next question is about their cardiovascular history. Sign number 7, clubbing, rounded bulge nails, one of the most well-documented physical signs in clinical medicine and one of the most serious on this list. In clubbing, the nail curves downward over the tip of the finger, which becomes rounded and bulbous. The angle between nail and nail bed, normally approximately 160 degrees, flattens to 180 or beyond. The fingertip resembles a drumstick. This develops gradually over months to years, almost entirely painlessly. People notice it, assume it's cosmetic, and say nothing. Clubbing is directly associated with chronic oxygen deprivation in peripheral tissues, strongly linked to chronic lung disease and to heart conditions that impair cardiac output. In an adult over 60 with no previously diagnosed lung or cardiac condition, it is a significant clinical finding, suggesting something in the cardiopulmonary system has been depriving the periphery of adequate oxygen long enough to physically remodel the fingertips. When I see clubbing in an unevaluated patient, I do not wait. I do not monitor. I investigate immediately. If your nails curve noticeably downward and your fingertips are more rounded than they were years ago, discuss this with your doctor before your next scheduled appointment, not at it. Sign number 8, dark lines under the nails, splinter hemorrhages, thin dark brown or reddish black lines running vertically beneath the nail plate. They look like splinters. And if you haven't injured that finger, they weren't caused by trauma. Splinter hemorrhages are small bleeds from damaged capillaries in the nail bed. Blood leaks out of the vessel, becomes trapped beneath the nail, and oxidizes to a dark color. In healthy adults, occasional splinter hemorrhages from minor trauma are benign. In adults over 60 with cardiovascular risk factors, spontaneous hemorrhages appearing without any trauma can indicate microemboli, tiny clots or plaque fragments breaking free from larger deposits upstream, lodging in the nail bed's small vessels. If plaque is fragmenting to the nail bed, it is fragmenting elsewhere. The same process in the cerebral microvasculature produces the transient ischemic attacks, brief neurological symptoms preceding stroke, that many patients dismiss as dizziness or confusion. Spontaneous splinter hemorrhages in multiple nails without nail trauma in a person over 60, I treat this as urgent until proven otherwise. Sign number 9, yellow thickened nails is the vascular type. Yellow nails have many causes. Fungal infection is the most common and most benign. If they respond to antifungal treatment, the story ends there. The yellow nails I'm describing are different. Thickened, slow-growing yellow nail plate persisting after fungal treatment, or in a patient with known vascular risk factors, points to something the nail is reflecting from the circulation, not the nail bed itself. Yellow nail syndrome in its vascular presentation is associated with lymphatic dysfunction and chronic venous insufficiency, downstream consequences of long-term peripheral arterial compromise. The nail changes reflect years of inadequate perfusion, accumulated layer by layer through successive growth cycles. This is the sign I mentioned last because it represents the longest timeline. These nails have been recording inadequate circulation for years. When I see this in a patient, my first question is not about the nails. It is about what else we have missed and for how long. One sign alone does not confirm arterial disease. Pale nails have common explanations. Slow growth has common explanations. Brittle nails have common explanations. But multiple signs together, 2, 3, or more in the same person over the same period, that is a pattern. Patterns in clinical medicine carry a different weight than isolated findings. Look at both hands, all 10 nails, under good light, without nail polish if possible. Are the nail beds uniformly pink? Is capillary refill prompt? Is the surface smooth? The growth consistent with 2 years ago? The tips unclubbed? If any of those answers is uncertain, if you're recognizing signs from this list right now, the next step is not online research. It is a conversation with your doctor with 3 specific requests. Evaluate my peripheral circulation, check my blood pressure and pulse in both arms, and discuss whether an ABI, ankle brachial index, a simple non-invasive measure of arterial flow to the legs, is appropriate for me. Those 3 requests at one appointment give your doctor everything needed to determine whether what you're seeing reflects a vascular issue requiring investigation or a benign coincidence requiring reassurance. Both outcomes are valuable. The investigation, if needed, is more valuable still because the earlier arterial disease is identified, the more options exist before it reaches the chest. Your body whispers before it screams. It whispers in pale nail beds and slow growth and cold fingertips, in ridges and brittleness and small dark lines appearing without explanation, for months, sometimes years, before the signal becomes impossible to ignore. Most people never hear the whisper, not because it isn't there, because nobody told them to listen. You know what to listen for now. Which of these 9 signs have you noticed in your own nails? Tell me in the comments. I read every single one, and if you've been told any of these were simply agent or cosmetic, tell me that too. If this gave you something useful, you share it with someone over 60 who has never thought to look at their nails as a cardiovascular signal. That share might be the most important thing you do today. Everything shared here is general medical information based on current research and clinical experience, not personal medical advice. If you identify multiple signs from this list, bring them to your own doctor rather than self-diagnosing. That conversation, specific and prompt, is exactly where good medicine begins. Take care of your heart, and starting today, pay attention to your hands.